Have you ever noticed tiny grooves or lines on your nails? These tiny lines or grooves that run vertically or horizontally across the nails can be a source of worry for many people, especially when they appear suddenly or become more pronounced. While nail ridges are often harmless, they can sometimes indicate underlying health issues. In this video, we'll explore everything about nail ridges, from what they are to what they mean, and how to treat them, helping you understand if it's something you should be concerned about or simply a part of life. So, what are nail ridges? Nail ridges are lines or grooves that form on the nail plate, which is the hard part of your nails. These ridges can run in two directions, either vertically from the cuticle to the tip of the nail, or horizontally from one side of the nail to the other. While it's perfectly normal for nails to have a slightly uneven surface, deep or noticeable ridges might prompt some concern. Number 1. Vertical ridges. Vertical ridges are by far the most common type of nail ridge. They typically start at the cuticle and extend to the tip of the nail. These ridges are often more noticeable on your thumbnails and big toenails. This type of nail ridges is usually considered a normal part of aging and can appear as we get older. If you've ever noticed that your nails look different than they did a decade ago, this could be one of the reasons why. As we age, the production of natural oils and moisture in our nails decreases, leading to a change in texture and appearance. Think of it as similar to how your skin develops fine lines and wrinkles as you age. Just like our skin becomes drier and more wrinkled, nails can develop ridges due to reduced moisture and slower cell turnover. These ridges are usually harmless, but they may become more prominent over time. However, aging isn't the only cause of vertical ridges. Sometimes, these ridges can be a sign of nutrient deficiencies. For instance, a lack of protein, calcium, zinc, or vitamin A in your diet can affect your nail health and potentially lead to vertical ridges. Iron deficiency anemia is another condition that can cause vertical ridges to form on your nails. In some cases, vertical ridges might be a symptom of eczema or psoriasis affecting the nail bed. These skin conditions can disrupt the normal growth of the nail, leading to ridges and other nail abnormalities. Dehydration can also play a role in the formation of vertical nail ridges. When your body doesn't have enough water, it can affect the growth and appearance of your nails, potentially leading to ridges. Number 2. Horizontal ridges. Horizontal ridges, also known as Bow's lines, are less common, and they often have different and potentially more serious causes. These ridges run from one side of the nail to the other and can vary in depth and appearance. So, they can appear as indentations or actual ridges raised above the nail surface. Unlike vertical ridges, horizontal ridges are more likely to be linked to an underlying health condition or a temporary disruption in nail growth. Some of the most common causes of horizontal ridges include: Number 1. Injury or trauma to the nail matrix. If you've experienced an injury to the base of the nail, where nail growth occurs, it can disrupt the growth process. This could result in a horizontal ridge appearing on the nail as it grows out. The injury could be something as simple as slamming your finger in a door or having a manicure that puts too much pressure on the nail. Number 2. Illness or high fever. When the body is under stress from a severe illness, high fever, or infection, it can temporarily pause nail growth. Once nail growth resumes, the ridge forms as a record of that disruption. For example, people who have had illnesses like pneumonia or even COVID-19 may notice Bow's lines on their nails afterward. Number 3. Certain medications. Certain medications can interfere with nail growth and cause Bow's lines. Chemotherapy drugs are a well-known example. These powerful medications target rapidly dividing cells, which includes cancer cells, but also the cells in your nail matrix. As a result, many people undergoing chemotherapy develop Bow's lines. Other drugs that have been associated with Bow's lines include retinoids, used for acne and other skin conditions, antibiotics like tetracycline, and some medications used to treat seizures. Number 4. Uncontrolled diabetes. Diabetes, particularly when poorly controlled, can lead to the formation of Bow's lines. The metabolic disturbances associated with diabetes can affect nail growth, and the compromised circulation that often accompanies diabetes can exacerbate this effect. If Bow's lines appear alongside other diabetes symptoms like increased thirst, frequent urination, or slow healing wounds, it's crucial to get checked for diabetes. Number 5. Thyroid conditions. Thyroid disorders, both hypothyroidism and hyperthyroidism, can potentially cause Bowes lines. The thyroid gland plays a crucial role in regulating metabolism, and when it's not functioning correctly, it can affect many bodily processes, including nail growth. Number 6. Raynaud's disease. This is a condition that affects blood supply to the extremities, so it can sometimes cause Bowes lines. This is due to the periodic reduction in blood flow to the fingers, which can interrupt nail growth. Number 7. Peripheral artery disease. This is a condition that reduces blood flow to the limbs, so can cause recurring Bowes lines. The reduced blood supply to the fingers can repeatedly interrupt nail growth. If Bowes lines appear frequently, especially in conjunction with other symptoms like cold hands or feet or slow healing wounds on the extremities, it could be a sign of this condition. Number 8. Heart attack. A heart attack can cause these horizontal ridges to form across all nails. During a heart attack, the body undergoes extreme stress, and non-essential functions like nail growth may temporarily halt. The appearance of Bowes lines a few months after a heart attack is not uncommon. Similarly, other acute cardiovascular events that significantly reduce blood flow, such as a stroke or severe arrhythmia, can also lead to the formation of these lines. As you can see, these horizontal ridges can have many causes. However, one important thing to remember about Bowes lines is that they're a record of past events. Because nails grow slowly, about 3.5 millimeters per month on average, a line near the base of the nail indicates a recent interruption in growth, while a line closer to the tip of the nail points to an event that happened months ago. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment for nail ridges. While nail ridges are often harmless, there are several ways to improve their appearance and prevent further ridging. If the ridges are related to aging or minor trauma, simple at-home treatments may help. However, if an underlying condition is causing the ridges, treating that condition will be necessary to improve nail health. Here are some common ways to treat and manage nail ridges. Number 1. Moisturize regularly. Keeping your nails and cuticles hydrated is one of the simplest ways to reduce the appearance of vertical ridges, especially if they're caused by dryness. Apply a moisturizing lotion or oil like coconut oil, jojoba oil, or vitamin E oil to your nails and cuticles daily to prevent dryness and keep your nails smooth. Number 2. Buffing the nails. Gently buffing the surface of your nails with a fine grit nail buffer can smooth out the appearance of ridges. Be careful not to overbuff, as this can thin the nails and make them more prone to damage. Number 3. Improve your diet. A healthy, balanced diet can promote strong nails and prevent ridges caused by nutritional deficiencies. Make sure you're getting enough vitamins and minerals, such as biotin, iron, and zinc, either through your diet or supplements. Foods like eggs, nuts, fish, and leafy green vegetables are all good for your nails. Number 4. Avoid harsh chemicals. Frequent exposure to harsh chemicals, such as those found in clean products or nail polish removers, can dry out your nails and cause ridging. Wear gloves when cleaning and use acetone-free nail polish removers to minimize damage. Number 5. Stay hydrated. Drinking enough water each day is essential for overall health, including nail health. Dehydration can cause nails to become brittle and ridged, so be sure to drink plenty of fluids to maintain hydration. At the end, while many nail ridges are harmless, there are times when you should seek medical attention. If you notice sudden changes in your nails, such as new or worsening ridges, especially horizontal ones, it's a good idea to consult a doctor. Also, if your nail ridges are accompanied by other changes like discoloration, thickening, or separation of the nail from the nail bed, these could be signs of a more serious condition and should be evaluated by a doctor. Now, we want to hear from you. Have you ever noticed changes in your nails, like ridges or grooves? How did you address them, and what was the cause of them? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.